I want to answer a question that a patient asked. It was, I'm taking gout medications, and this actually goes for almost all the gout medications, right? That lower uric acid. I'm taking gout medications and I'm getting gout attacks. Why am I taking the gout medication? So my name is Dr. Aminola Dada. I help people with joint pain and gout pain become pain-free, and people with autoimmune disease get their immune system back on track. So let's answer those questions. If I'm taking gout medications, why am I still getting attacks? So gout, as you know, is a process because your protein, which is protein either from what you're eating or protein from just the metabolism of your body, gets broken down. And when it gets broken down, it forms uric acid. For some people, the process of clearing the uric acid is not very efficient, right? So the uric acid builds up in the blood, but because the blood can't handle high uric acid level, it ends up in the joints. And typically, uric acid likes to settle in cold joints. So that's why uric acid actually goes to the joints. So there are different medications used to treat gout. So whether it is a medication called allopurinol blocks the formation of uric acid. And so instead of forming uric acid, which is a crystal, it's an enzyme, and it blocks that last process from conversion of the molecule called xanthine to uric acid, and it blocks it. And so what you have, instead of having an accumulation of uric acid, which is difficult to get rid of, you have more of an accumulation of xanthine. Xanthine, your kidneys can excrete it very easily. And so basically all it's doing is just preventing the formation of uric acid. So allopurinol and Uloric work similarly, where they just don't allow your body to go through that final step, and it blocks formation of uric acid, and you can excrete the product before uric acid. And so that's how those work. The other medication called Krystexxa, which is an intravenous medicine, which is one of the latest and greatest medicines for gout, it actually goes and it melts all the lumps of tophi all over the body. And so it melts it into a form that you can excrete, and it gets rid of it that way. So the reason why people get attacks when they're taking medications that stop uric acid production or help them lower their uric acid is because the process of lowering uric acid, so whatever you do that stops your body from making any more uric acid, or if you're even trying to do it naturally, so you're avoiding the known triggers. Let's say you used to drink beer, you don't drink beer. You used to eat shellfish, you don't stop eating shellfish. You start increasing hydration and you stop eating things with high fructose corn syrup. So if you do those things naturally, or you use medication, right, you can end up where the blood uric acid is low, and you say, yes, this is what I want. Or let's say, someone's having a shrimp party. So you go, you have shrimp, you have shellfish, you wash it down with beer, and your uric acid levels go up. So anytime there is a fluctuation in uric acid, the uric acid level is going down or uric acid levels coming up, you are prone to a gout attack. Right? And the reason you're prone to a gout attack is, let's say, if your uric acid in your blood goes down, right, then that means that the uric acid concentration in your joints is high. And so the uric acid is trying to get out of your joints. And you're like, yes, that's exactly what I want. So you stop eating shellfish, or you're on a medication, uric acid levels goes down in your blood, and you're like, this is great. But the uric acid will now get out of your joints, and you're like, that's what I want. Or in the opposite situation where, there is a party and you have some beer and you have some shellfish, and your uric acid in your blood goes up. Well, it can't stay up. So the uric acid will then go outside into your joint from your blood. So the blood is only going to keep a certain amount of uric acid. So you either come into your joints if the blood level is low, or go out of your joints if your blood level is high. So I hope that makes sense. Let me say that again. If the blood uric acid level is high, it will go into your joint. If the blood uric acid level is low and you have uric acid in your joint, it's going to come out of your joint. Okay. So now I've said there can be a flux of uric acid in and out. Why does that matter? The reason why it matters is because anytime your white blood cells see things that don't belong in certain places, they go and they attack it. So if your uric acid is moving in and out of joints, your white blood cells, which are supposed to protect you from any kind of invasion or infection or anything, it sees the crystals and it says, well, this does not belong here. And so the white blood cells head there and they try to swallow up and destroy the crystals. They can't. And that is what causes your attack. So it now makes sense that anytime your uric acid level is fluctuating, you are prone to attacks. So you're on the medication to stop uric acid from being made. Your blood uric acid levels go down. Uric acid comes out of your joint. You get an attack. Or, there's a shellfish patty. You have that. Blood uric acid level goes up. It moves into your joints. Your white blood cells say, what is that? They go, they try to engulf it. It causes a war. And that war is what you feel as an attack. Right? So I hope that helps that part. So therefore, when your doctor puts you on allopurinol or Uloric or Cristexa, you're most likely prone to attacks. So your doctor will put you on either some prednisone, or some doctors will put you on some colchicine, or some doctors will put you on anti-inflammatory medications, which I do not like because it can affect your kidneys. But those are medications which helps to prevent the attack. So the way I explain how colchicine works, which is my favorite to prevent attacks, is that it turns off the light. So it turns off the light, and so your white blood cells can't find the crystals. So a lot of time you're taking colchicine plus allopurinol, or colchicine plus Uloric, or colchicine plus Cristexa. So that is the way we try to prevent attacks of gout. So if it makes sense, right? So some medications are just stopping your production of uric acid, period. That's it. That's all they do. Or they melt your uric acid crystals, but they will not help you with pain. Then you need another set of medications, whether it's steroids or colchicine or anti-inflammatory medications that I do not like, to help to prevent attacks or treat attacks, while your overall long-term goal is to lower uric acid. So the goal with lowering uric acid is to get your uric acid persistently less than 6 if you have gout. But if you have lumps of gout, then the goal is to get it less than 5 milligrams per DL. So my name is Dr. Rinola Dada. If you're in the Greater Seattle area, look us up at Overlake Arthritis. Like this video, share it. Share it with anybody that you think will be helpful too, and then subscribe to our channel at Healthy Joints, Healthy Life, and we are happy to help you on your journey to a healthier you. Take good care.